My name is Ivy and I'm a Purdue Northwest nursing student, and I will be demonstrating how to properly insert a female catheter. Before I begin, I will look at my patient's medical records and determine the need for a urinary catheter and look for the order placed by the physician. I will then gather all of the necessary supplies, like my wash basin with my warm water, my towel and my rag, my clean gloves, my hand sanitizer, and of course my Foley kit. I will then go into the room, perform hand hygiene. As I'm performing hand hygiene, I will then identify my patient. Hello, Mrs. Jones. My name is Ivy. I'm going to be inserting your catheter here today. Can I see your ID, ma'am, please? Wonderful. Can you verify your full name and birthday for me? Great. So then I will explain the procedure to my patient. Mrs. Jones, I'm going to be inserting this catheter. It might be a little bit of an uncomfortable procedure, but I'm going to do my best to make it as smooth and easy as possible. I will then don my clean gloves and raise the patient's head to elbow height or just good working level. And then I'm also going to lower this side rail just because I'll have more room to work. After that, I will then grab my wash basin with my towel and my washcloth, and then let Mrs. Jones know that I'm not going to be inserting anything yet. I'm just going to be cleaning up the area. I'm going to make a mitt with my washcloth, get it in the water. Mrs. Jones, I am going to touch you now. I'm going to clean your labia here. So I'm going to open, and then I'm going to clean top to bottom on the left side, working my way in. Switch the cloth a different way each time, and then clean the right side, and then switch the cloth one more time, and clean the middle. You're doing great, Mrs. Jones. I'm going to discard my water and then pat the area dry. After the area is dry, I'm going to discard my clean gloves and then begin the prep for my sterile procedure. I'll perform hand hygiene one more time, and then do my Foley kit, making sure that your Foley kit is dry, unopened, and unexpired. For the sake that we've been practicing with this one, this is opened, but you would pull the wrap off the side and then take it out gently. So I will take my wrap here. I'm going to fold it down and use it as a trash bin if I don't have access to my other trash bin, just in case, just because I need to be able to have space. I'm going to move my box over here and then unfold it away from me carefully, only touching the 1-inch border. And then take out my sterile gloves. I'll grab it by one corner, opening away from me. I am going to flip it because I opened it the wrong way. Open. And then don my sterile gloves. I will mention here that if my patient did have legs, I would have placed her in a dorsal recumbent position, but my patient does not have legs. And then unfold the cuff here, and then discard. Now my hands are sterile and I can touch everything in this kit and not worry about it. So then I'm just gonna set up my area. And then I'm going to move my box. Set my catheter here. Mrs. Jones, are you allergic to iodine or latex? Oh, you're allergic to iodine, that's great. So then I would toss the iodine, but I only have iodine in this kit, so I'm just gonna pretend it's hydrogen peroxide. So what I would do is I would open it and then pour it all over my cotton balls here, and then discard in the trash, and then fluff my cotton balls like so. Then I would take my lubrication and put it here into the tray. After that, I would take my syringe and attach it to the port on my catheter, making sure not to lose that because I'm gonna need it again. After I've attached that, I'm going to place my end tubing here in the lubrication. And then, all right, Mrs. Jones, I am now going to clean your area once more before I insert your catheter. I'm going to then take my non-dominant hand and place it over and spread the labia. This hand is now clean, it is no longer sterile, and I can no longer touch anything in this area with that hand. So taking that hand, I'm going to spread them apart, take my cotton swab here, and clean and discard, clean and discard, clean and discard. After Mrs. Jones, I'm going to insert the catheter now. It's going to be a little uncomfortable. I just want you to take a deep breath and bear down for me. And then I'm going to take care not to touch the patient's genital area here as I'm inserting the catheter. I'd imagine this would be a little easier if my patient had legs and not just an open hole in the back of this, but that's okay, we'll work with it. And then you want to insert the tube just about until you see that flash of urine, and then you want to advance the tube about 2 to 4 centimeters and further, like so. I will then take my sterile hand and inflate the balloon, holding it with the clean hand. After the balloon is inflated and I tug and feel resistance, it is now a clean procedure. So I can go ahead and unscrew my syringe, toss it like so, and I take the bag here. If my patient had legs, I would secure it to the legs with a leg strap, but my patient does not have legs. And then I would want to hang this bag down on the side of the bed here, making sure that everything is closed. And then, hi Mrs. Jones, how did you tolerate the procedure? Ask her about it just so you can document it in the notes. And then I would, with my gloves on, clean everything up and go out and document everything. For the sake of this video, I have to remove the catheter as well, so I'm just going to go ahead and do the procedure for that. To start, I'm going to take the bag. Well, I would do hand hygiene and put on clean gloves, but for the sake of the procedure, I'm just going to leave these on. I would take the bag off the side of the bed, drain the urine into whatever collection device needed, unstrap the leg strap that she doesn't have, and then I would take my syringe and attach it back here to the port, and then I would let the sterile water flow naturally back into the syringe. We had about 10 milliliters in here, so this might be a minute. If you just pull it out, it could cause damage to the urethra, so we don't want to do that. So we are now at 4 milliliters. We're at 7. During this time, I imagine I would talk with my patient. Hi, Mrs. Jones. Like, how's your day? How are your grandkids? That's amazing. I hope you're doing awesome. Okay. We are just about at that 10 milliliter mark. After that is full, I'm going to go ahead and detach the syringe. I'm going to let Mrs. Jones know that I'm going to touch you. I'm now going to pull out your catheter. I want you to take a big deep breath for me, and I'm going to pull quickly and wrap it into my glove. So, 1, 2, 3, pull the catheter out, discard into the gloves, and just toss the whole thing into the trash, and then clean up and go try the rest. That's all.